Are we seeing the person or are we seeing the patient? I'd like to start with telling you a story about someone I loved dearly, my brother. It was on the 25th of February 2023. And for those of you who follow South African football, since it is a football season, that was the day of the Derby Chiefs versus Pirates. And so I support Pirates. He also supported Pirates. We had gone to go watch that game, and happy to say Pirates won that day. And so we were all excited, happy, screaming all the way. But on our way home, I was the one driving, and here he was sitting right next to me, also screaming, excited. But all of the suddenly, he goes, "Ah, there's some sharp pain that I'm feeling," and he's screaming his lungs out. And that type of pain that you could just see and feel by looking at him. And so suddenly I decided, you know what, this is really serious. Let me rush to the nearest hospital. So we stayed in Midrand at that time. We were coming from Joburg South. And so off I go to Mill Park Hospital. We spent hours after tests and all the investigations that were happening, chaos, and suddenly we were called in as the family to be informed of the most unexpected and the most devastating news that we've ever had, that he has got stage 4 colon cancer. And what I didn't know is for the longest time, over a year or so, he has been going to a GP, different GPs, trying to get medical care. And there's been some misdiagnoses, others suggesting it's just ulcers. But ultimately, it was cancer. And so suddenly, everything kicked in. All the processes, the forms to be completed, all the authorizations, and suddenly we needed to now start learning about our benefits. Um, you know, yeah. So from that moment going forward, it felt like the system saw yet another cancer patient, and it was ready to process him, like in production line. So move from one referral doctor to the other specialist, and it was the reality that we had as a family. And to us, he was just a brother. He was someone who still had dreams, someone who still wanted to see yet another derby. And so that experience still lives with me. That experience is the reason why I ask this question. Are we seeing the person or are we just seeing the patient? I was introduced earlier as a healthcare strategist, and if I am to be honest, the person who teaches me a lot about strategy is none other than my beautiful daughter here. You see, my daughter has got a habit that drives me absolutely crazy, but I secretly adore. She can ask you why, not once, not twice, and she can even have the gut to tell you that, Daddy, that's a bad answer. if if she's got that mindset and she can persist in asking questions, I often wonder, as a strategist, isn't ours to ask those difficult questions? Isn't maybe ours to ask the explanations of why things are the way they are? Aren't we maybe supposed to challenge the assumptions you mentioned earlier, Michael? So I think about that, and I do get to sit in many of these meetings where I see us accepting what sounds like a first reasonable answer whenever we ask questions. But my daughter will easily say, that's a bad answer. And so for today, I decided, why not adopt my daughter's mindset and maybe use this opportunity to ask those difficult questions. And I'm going to ask, well, not too difficult. And I'm not going to use Menti. I see we've got Menti that, can help tell who's what we think and so on. So I'm going to ask some of those questions. The first question I want to ask today is, why don't we have a single view of the patient? You see, my brother had interacted with the system. He had visited GPs. He had even, in fact, A nice story about him is that just after he had passed, we had then gone to his or to close his bank accounts, and so I had asked that they give us his banking statements, and had a look at all his transactions. I personally could easily tell some of those patterns were telling a story. Him accessing healthcare, buying some medication. As a matter of fact, there were moments where he started doing things that he wasn't supposed to do when he was already diagnosed with cancer. But nobody knew. That information existed. It lived in different systems. And it is for that reason that I think about where exactly and how is it at this day and age we're not able to see that full profile of that patient. And I'm glad that some of my colleagues, Dr. Musima, you also touched on this. We need to start looking at a complete or that holistic profile of the person. And it's exactly the future of healthcare. The second question, and I'm going to have some interactions with you, and I'm going to be expecting not easy answers on these, I swear. So the second question I'll ask is, so if technology exists today, why are we not using it to connect the dots? And I mean, I can even come up with situations where I started imagining a situation where a medical scheme for a moment being able to pick up on those patterns and immediately acting on what was probably a highest risk at that time. That for me is caring but not managing care once it happens. Because that information existed and the technology, different technology companies are here. The third question I'll ask is, why are we still waiting for people to get sick before we start helping them? And I'm not going to say much on this because already we know of the amazing work colleagues touched on this earlier, but it really matters if we want to flip the story around seeing patients as people. This is the opportunity we have, and perhaps it's the only future we have with where the patient-centric models are going. And so today I'm going to ask again, and when we have those chats, these are some of the questions I would really be asking. And so with all of that and the questions that has come through, I do want to share that at Altron Health Tech, we started dreaming and not just dreaming, but putting down a very sober and clear vision of where we best believe is the future of healthcare. And we do see a future where we are able to see that connected healthcare journey around the patient, and I mean holistically, whether the patient goes for shopping at Checkers and buying all the healthy, non-healthy stuff, or the patient is buying alcohol, we are able to see what's happening with that patient. And we can think about how things make sense to make a full profile of what that patient looks like. But secondly, we also see a future where healthcare professionals are able to have the right information as and when they need it about that patient, not at that time when they become sick. And we do also see a future where everyone work from that shared understanding or common understanding, and I mean funders, providers, clinicians, and importantly, patients themselves, understanding of what is it that we're doing with that care and how is it that the care is going to deliver. And ultimately, it is the importance of knowing that technology enables the ecosystem and it can help us have that better coordinated care. With that, ladies and gentlemen, I'll ask again, are we really seeing the person or are we just seeing the patient? Remember, I won't be taking easy answers. Thank you.